Will I need to restrict my physical activity after my valve replacement?
After any valve replacement procedure, you can expect to feel tired or short of breath and have a decrease in your endurance. Gradually, you will increase your activity level and should be able to do many of the activities you are doing now and likely have an increased capacity for physical activity. After a surgical valve replacement, you may feel tired for a few weeks and require frequent rest. If your replacement requires a sternotomy, you will need to limit your physical activities after the procedure to allow your breastbone, your sternum, to heal properly, and this could take between 6 to 8 weeks. After your procedure, you will start a prescriptive walking program and possibly cardiac rehabilitation, depending on your condition. Most patients are walking 20 to 30 minutes by the third week following surgery. At 6 to 8 weeks, you can typically cycle and do light housework, such as sweeping. 3 months following discharge, you can resume heavier activities such as vacuuming, moving the lawn, tennis, and golfing. With minimally invasive cardiac surgery, the incision is smaller, the recovery is shorter, and the return to an active life is faster because you don't have the incision in your breastbone. On average, recovery can take 2 to 4 weeks, but each patient journey is unique and can be impacted by age, preoperative health, and fitness. Typically, after a cardiac-based valve replacement, you will have a few hours of bed rest, then you will be able and expect to be up and moving the next day. Every day, you will be able to do more activities and walk farther. During recovery, you should not lift, push, or pull more than 10 pounds and avoid activities that involve using your arms above your head or exercise that make you hold your breath for a week. Regardless of your procedure, it is important that you do not engage in strenuous activities or exercise until you have been cleared to do so by your healthcare provider.